Hi, I'm Dr. Matthew Maggio, owner of Peak Performance Sports Therapy, as you can tell by all the gear that I'm decked out in. This is going to be the first video in our series where you can ask a doctor the question about any problems you're having, any pain, diagnosis you may have, or anything that you just want to ask me. So this week we got Christine and Linda have both asked me a question about hip bursitis and getting cortisone shots for that. So let's go in there a little bit deeper. So Christine wrote, any advice for bursitis in the hip? Have been struggling with this for longer than I care to admit. I have gotten better shoes, orthotics for my CrossFit shoes, and cortisone shots. I think I heard you cringe. Sleeping is the worst. Would be interested in hearing your opinion. Thanks. And Linda also wrote, I have it too. Had one cortisone shot, worked for a couple days, and now it is horrible. Doctor said I have another shot, yay, and mentioned Celebrex or Lyrica. But I can't take any of them other NSAIDs because of my other medicine. Said there is surgery, but it's pretty rare to do it. So let's just first talk about bursitis. Anytime someone gets diagnosed with a bursitis, tendonitis, something like that, it's just a fancy way of the doctor saying, I really have no idea what the hell is going on with you. It's showing that there is some type of inflammation there and some type of swelling. We've conveniently just point at things that hurt in the body and say, that's got to be tendonitis or bursitis. You get the standard junk box diagnosis that says, lay off it, get an injection, take some pills, do this and all that. But you know what? It really doesn't work for the problem. When I hear bursitis, I think what's going on, and probably that the hip is getting overloaded. Why is that hip getting overloaded? Because all the surrounding structures aren't doing what they're supposed to, and it's causing the hip to get overworked. When the hip gets overworked, the body has an inflammatory response and starts to put more fluid, scar tissue, all sorts of things to help ease the load. A lot of times what I find with a hip dysfunction is that it's just not moving correctly, and a lot of times that's due to the adductor not functioning correctly or a problem in the actual hip capsule. One really good way to test this out on yourself is just lie on your back and grab behind your knee and try to bring your knee to your chest. You should be able to easily get your knee to your chest. If you can't do that, chances are that you do have some dysfunction in that hip capsule or the adductor. Usually it's a scar tissue buildup just from overuse, and that's causing the bursitis or the pain that you're having in the hip. No amount of orthotics, changing your shoes, changing your lifting process, anything like that will get rid of that dysfunction. It'll just continue to build up, and you'll start to get more and more inflammation. Now, when I hear cortisone shot, I get pretty upset. I feel when a doctor gives a cortisone shot, it's lazy, ineffective, dangerous, and really does nothing to actually fix the problem. All it does is block the pain, but you're still having all the problems in there, so it doesn't improve function. Any treatment that just focuses on pain and doesn't improve function is dangerous. There's actually more and more studies coming out showing the actual ineffectiveness of cortisone, how it actually keeps the healing process from happening and causing you to get more and more scar tissue. So if you've had a cortisone shot, please never get another one. It's doing nothing to actually fix your problem and actually might cause more problems down the road. Basically what I find with bursitis is it's just, like we said, that junk box diagnosis, and it's really nothing true. So try that test out on yourself and see what happens. And if it is limited, chances are you do have some dysfunction in that muscle that can be fixed by a trained practitioner who specializes in soft tissue diagnosis and treatment. I really appreciate you guys taking the time to send some comments, and we look forward to doing this every week. If you have any issues or things you want us to go over, any problems or dysfunctions you want us to talk about, please feel free to comment, send us an email, or share this with anyone else out there. We really appreciate everyone getting involved in this, and thank you.